Welcome to today's discussion. I'm joined by Nancy Green, Verizon's Global Healthcare Practice Lead, and Peter Pinn, Verizon's Regional Vice President of Civilian and Public Sector Markets. Welcome to the program.
Thank you.
Thank you.
Today we'll be discussing three drivers transforming healthcare delivery: consumer engagement, mobility, and digital strategies, and the impact technology plays on all three. Infrastructure companies like Verizon will no doubt play a role in delivering the technology to these drivers. So Nancy, let's start with you. Where is technology driving and shaping this trend toward consumer engagement?
So the consumers, or what we would call patients in healthcare, are leveraging all the technology, so the internet, apps, mobile devices, to really become more informed, right? So, and often at the point of care. You might be sitting in a doctor's room and an office and being able to query what's the next thing to do, or we have a story that I was told that someone was to learn how to do crutches, and instead of waiting for the physical therapist person to come, they Googled it themselves and said, I got it, don't worry about it. So they're using technology really in a new and different way. Millennials especially, got to remember that they have never lived a life without the internet or social media or mobile devices. So they really use how they interact with the healthcare system, any part of the healthcare system, in a different way, and we have to react to them differently. Low tech doesn't work. It has to be a good experience the first time, or they will leave.
Yeah, the expectation is high with millennials, and they really are driving a lot of these adoptions that we as a society have with technology, right?
Yes, absolutely.
So tell me more about what it looks like at the point of care, because that's a really, really powerful thing, I think.
So one of the main drivers or disruptors within the healthcare space is a care anywhere / consumerism. And the care anywhere has to do both with the patient side and the clinical side, and mobility is a factor in all of that. And the interaction with being able to have information where you need it in a secure manner, wherever you want it, is a key factor.
How does that work together, a little bit of that, when you want it and how you want it, but securely, right? That's important.
Yeah, well, it's foundational to what we provide, right? So it has to be, the network has to be secure, whether it's a mobile network or a cloud network, and the security across the board. And where the strength is in the interconnection of all of that.
Peter, from your perspective on the public sector side, where do you think this is all going?
Well, I think we're seeing similar trends in the public healthcare as well. I mean, citizens, veterans, want to engage in their healthcare providers really in the same way that they consume other digital products and services in their lives, meaning they want it when they want it, how they want it. And now, with mobility, it's where you want it. But we're seeing agencies that are stepping up to this. And one of the great examples is really the Veterans Administration that are doing a number of initiatives. One of those is the Mobile Health Provider Program. And what that's really doing is taking these services right out to the veteran. The VA Digital Services team is really concerned about what that end user experience looks like and improving it. One of the things we're seeing now is this new site called vets.gov, which is going to be really that portal to give veterans benefits in one central location, a way to get to the thousands of websites that the VA manages. And at the end of the day, this is really going to increasing the satisfaction of that end user and the experience he has when he's engaging with his healthcare provider.
So focusing on the end user, it sounds almost like a shift in some ways. Of course, we have VA hospitals around the country, and that likely will never change. But are we moving towards a scenario where maybe there's less reliance or emphasis on the veteran going to a facility, and maybe the facility or the expertise that it provides going to the veteran?
Absolutely. And in fact, it's almost like the walls are coming down. And the traditional ways we've dealt with patients and interacted has changed. And so what's doing that is that ability to access a network or a series of things that are out there but not connected where you're sitting. And that's what's happening. And it's changing the way that that interaction between providers and patients is going.
It has to be the clinician too, if I can add. The clinician has to be just as mobile because there's such a lack of clinicians and more patients coming in. So there has to, the mobility piece of it, or the digital transformational piece of what's happening in healthcare, that's a big driver.
So it's really a two-way street then. So Peter, what kinds of responses have you heard on this shift? What are the users, what are the vets saying about it?
Well, from what a lot of these are pilot programs that they're rolling out, and some of them initially are getting great results, great feedback, because you got to realize a lot of veterans don't have that, the wherewithal to immediately get up and go somewhere, or it's not timely, and so that nature of that care is affected. Whether it's delayed or just not there when they need it immediately. And that's changing, and that's all of a sudden now you're acting like a millennial in many ways, and that you want this right now, and you can get it right now. But there's a lot that has to happen before an agency can put in place the processes to make it happen. It's not just about the technology.
How does Verizon play a role in shaping this healthcare picture, and what's the consumer focus here? Nancy, let's start with you.
Sure. I think foundationally, nothing that healthcare is dreaming big about can be accomplished without a very strong, compliant, and agile network or foundation. And when the consumer is interacting with the healthcare system, it has to have those factors built into it, especially around that care anywhere. But not just the mobile side. More than just that, the interconnectivity, I think, Peter actually brought up a point of all the agencies having to connect to each other or sources to connect. All that interconnection requires security. So you have to feel that your patient information and protected health information is secure, as well as being able to access other information from any other site or source.
So a number of pieces obviously involved in this puzzle. Then.
Yeah, the integration is key. What's one of the things that we struggle with in healthcare is all the different systems and agencies and organizations working together. They're all disparate systems, and so the interchange of all of that is a strength of ours.
And Peter, your thoughts from the public sector side?
Well, very similar in that Verizon plays this role as almost being the glue in many places for connecting that end user device that sits in the hand of a patient or a clinician, all the way back to the network and into the cloud where the data resides, and making sure it's secure.
All points in between.
So really the hub with all of these spokes pointing out of it, connecting to the wheel then.
Absolutely. We call it enablement, so we're enabling the industry to do what they need to do when they need to do it.
Well, I think that's a good place to stop, and we'll pick up with it more here in just a minute. We're going to pause here for a short break. My guests today are Nancy Green, Verizon's Global Healthcare Practice Lead, and Peter Pinn, Verizon's Regional Vice President of Civilian and Public Sector Markets, on healthcare in the public sector, sponsored by Verizon Enterprise Solutions. I'm your host, Jason Fornicola, and you're listening to federalnewsradio.com and 1500 AM.